Welcome to CCK Live Under 5. I'm Kayla D'Onofrio, and in this video, I'll be explaining compensation and pension, or C&P exams, for gastroesophageal reflux disease, also called GERD. GERD is a digestive disorder that's characterized by the occurrence of stomach acid flowing back up the esophagus from the stomach, which causes discomfort and inflammation. It's essentially frequent episodes of acid reflux. Common symptoms of GERD can include things like heartburn, difficulty swallowing, regurgitation, and chest pain. Typically, GERD is rated analogous to a hiatal hernia under the Regulation 38 CFR 4.114 under diagnostic code 7346. It'll be rated at a 10%, 30%, or 60% rating depending on the severity and the symptoms that are associated with it. Analogous ratings, like in this example, are used when certain conditions are not specifically listed in VA's rating schedule. If a condition is not listed, VA will rate it under a diagnostic code for a condition that's closest to or that requires the same treatment. So in this example, GERD is not specifically listed under the rating schedule, but it has very similar symptoms to hiatal hernia, and it's often treated with similar methods. C&P examinations are medical exams that VA requests to examine a veteran's condition or their disabilities. So for this example, it'll be GERD. Your exam is going to depend on what you're seeking. If you're seeking service connection or an increased rating, what questions the examiner asks may vary slightly. In most examinations, they should be asking you questions about the symptoms that you're experiencing and the severity of those symptoms. The examiner may also administer a blood test to help screen for things like anemia, if that's a symptom that you experience as related to your GERD. If you're seeking service connection, they may also ask questions regarding the onset of your symptoms, details about your military service, or whether there's a link between your military service or other service-connected conditions. So it's really important that you're honest with your provider about your GERD symptoms throughout the exam. And also note any other conditions that you think may contribute to your GERD. Some examples might be things like PTSD, COPD, if you're taking NSAIDs for pain treatment for maybe like a back condition that's causing pain. Some of those different things can contribute to or worsen symptoms of GERD. Veterans are also able to request a copy of their C&P exam results after the exam has been completed so that they can go over it and ensure that everything was documented correctly. If it was not documented correctly or the exam was unfavorable, veterans do have the option to challenge that exam and submit extra evidence to support their claim. In GERD cases, veterans might want to consider having their primary care or treating physician fill out a disability benefits questionnaire or a DBQ form. This form is more or less the same information that a C&P examiner would be filling out during a C&P exam, but it just gives your own healthcare provider a space to answer questions about your disability related to the symptoms that you experience, the severity, what may have caused it, or whether it's related to any of your other service-connected conditions. And sometimes it's good to have someone who's familiar with you and your record and your medical background to provide some of this information to VA. And I think that's a good place for us to end this video. For more information on VA claims for GERD, C&P exams, and the rating schedule, you can check out our other videos or head over to our blog. Thank you so much for watching, and don't forget to like this video and subscribe to our channel.